An inclusive dementia-friendly environment is one where the space supports the needs of persons living with dementia. The Singaporean Environment Assessment Tool, SEAT, and the Environmental Assessment Tool, LIGHT, EAT LIGHT, are developed to assess whether an environment is dementia-friendly. Both tools are developed to be a systematic and evidence-based platform used by design and non-design professionals, such as care providers and policymakers, to review facilities and their effectiveness as an inclusive space. SEAT was developed by Dr. Joanna Sun and Professor Richard Fleming. The tool focuses on key aspects of a dementia-friendly environment, which include 1. Effects and perceptions of an environment on the brain, including shapes, patterns, and sensory cues such as sounds and smells. 2. Deep diving into an inclusive environment, guided by evidence-based design principles. And 3. Being culturally adapted for Singaporeans while still being rooted in international standards, which can help identify areas for improvement. EAT LIGHT was co-developed by Dr. Belinda Yuan from SUTD, MOH Office for Healthcare Transformation, MOHT, and the Urban Redevelopment Agency, URA. It aims to equip stakeholders such as town councils with a tool to evaluate and identify areas of improvement to make the public neighborhoods more dementia-friendly. In this video, we will speak to key individuals who contributed to the development of SEAT. They will discuss the principles, how to use the environment assessment tools, and how SEAT was developed and localized for dementia care in Singapore.
I am Yan Ting with the Caregiving and Community Mental Health Division, Agency for Integrated Care. Besides building and increasing capacity for care services, promoting and facilitating early diagnosis and prevention strategies, there is a need for us to build dementia-friendly community. One key element of the dementia-friendly community is building a dementia-friendly physical environment that empowers persons living with dementia and caregivers to continue enjoying the facilities within their neighborhood. It could be as simple as going down to the nearest coffee shop for a cup of coffee, heading down to the hawker center to enjoy their lunch, or doing supermarket shopping. Yio Chu Kang, Kebun Baru, Nee Soon are such constituencies that have worked very closely to make this happen. Their grassroots organizations collaborated and partnered with social service agencies, hospitals, town councils and HDBs to introduce design features within their neighborhood. That includes maybe bigger block numbers, having brighter and contrasting colors to facilitate wayfinding. The use of motifs, icons also build that sense of identity within the neighborhood. One example that I would like to share is Ting Ting. Her father and mother, they both all stay in Nee Soon. They have shared that how the dementia-friendly design within their neighborhood has helped their father, who is living with dementia, to continue enjoying the facilities and activities they used to do so. As a sector developer, AIC works with various stakeholders to develop a suite of resources and toolkits to enable the sectors. One example is AIC working closely with Dementia Singapore to co-develop the 360 degrees virtual reality HDB design guide. What prompted us to work on this was the lack of local resources to help caregivers to create a age-friendly as well as a dementia-friendly home environment for their loved ones at home. It has received very good feedback from caregivers on the benefits and the use of it. Another example is AIC working closely with the Centre for Livable City CLC as well as Singapore University of Technology and Design SUTD to develop and conduct this dementia-friendly neighborhood study. This is the first in Singapore and is being piloted at Yio Chu Kang. With the findings and learnings from this pilot, we aim to create a set of guidebooks which can be used by the building sector in future building as well as maintenance projects. Another key project that we are working on is to, of course, support our community care partners. We developed a set of dementia-friendly nursing home guidebook, which actually aims to help our nursing homes as well as center-based partners to create and build the physical environment, which is homely as well as empowering for residents staying in such facilities. Capability building is very important in this series of e-learning tools with the aim of creating resources for the building sector to increase their understanding as well as awareness on the importance of incorporating dementia-friendly design principles within their projects. In addition, we are also collaborating with BCA to include dementia-friendly design principles within the Universal Design Assessor course as well.
Well, both the SEAT and the ADI report have got the same set of 10 design principles at their core. Now, these principles were central to the writing of many of the chapters in the report, and they structure the SEAT. Their acceptance by the 58 international contributors to the report shows that they represent an emerging consensus on how to design well for people living with dementia. The SEAT uses these principles as the basis for conducting a systematic review of environments for people living with dementia, and shares with us the tools developed in Australia, Japan, Germany, China and the USA, and focus on those 10 design principles. I'm pleased to say that the SEAT was very carefully developed to ensure that the questions in it are carefully tuned to the Singaporean context. Well, I'm hopeful that the consensus that is emerging on the principles will grow and strengthen. One of the spin-offs of the ADI report was the launching of the Dignity Manifesto of Design for people living with dementia. And I do hope you get a chance to have a look at that. Design experts, advocates and people living with dementia from more than 30 countries have signed that manifesto, indicating their support for the principles that have been used in the SEAT. I believe that this consensus has the potential to provide an organising framework that will help us to improve the international conversation on the way we design for people living with dementia.
An assessment tool is really useful for Singapore because assessment tools essentially in itself helps us to evaluate our environments. So for the Singapore Environmental Assessment Tool, it allows us to understand how well we are designing our environments and what we can do to improve it. Not only that, the assessment tool can also bring together people from different backgrounds, so people from multidisciplinary teams. So you can have architects, administrators, nurses, designers, all together to have a discussion on the design. So it can be a very collaborative, communal platform. Lastly, the assessment tool is also very culturally specific. So our Singapore Environmental Assessment Tool has questions and themes that are very specific and very unique to our population that no other country has. It's based on 40 years of research and is adapted from the Australian Environmental Assessment Tool. So the Australian Environmental Assessment Tool in itself is very much grounded, like I've mentioned before, in decades of research. And on top of that, both of our tools, the basis of our tools comprise of 10 principles of design that have been recognized by the Alzheimer's Disease International, so ADI. And in 2020, they've published the Alzheimer's Disease International report. And within that report, they recognize these 10 principles of design as international best practice and evidence-based. So our environmental assessment tool is very much aligned with international best practice and what's recommended, not just locally, it's also recommended overseas.
We hope the sharing provided insights on dementia-friendly environments, SEAT, and how to use SEAT to review your space.